Perfect. So welcome, everybody. Thank you for joining us for this webinar training on insurance coverage for incontinence supplies. Again, I'm Kimberly Peralta, the National Support Group Program Director for Foster the Family, but I am also a foster adoptive mom. My husband and I, we have been foster parents for the past 9 years, and in that time, we have adopted 5 children out of medical foster care. And I am so excited about this training because the information that's going to be gone through today is things that I wish I would have known about 5 years ago. So I'm so excited for them to be able to share all of this with you. Mica Phillips is here with us. He's the Executive Vice President of Aeroflow Urology, and Peter Mutabazi, well-renowned author and advocate for children in foster care. I'm so thankful to have both of them here with us today. When we start, Mica Phillips is going to start by going over the process of how Aeroflow Urology hopefully can help your family and the kids in your home. And then Peter will follow up by sharing some valuable experiences that he's had based on his journey with foster care and adoption as well. At the end of that, we will have a Q&A. So please, during the presentation, if you have questions so that you don't forget them, you can throw them in the chat. And then at the end, we'll go through all those questions and answer them for you. And at the end of our training, I'll send you a follow-up email that will have the link to this training. You'll get a training certificate as well. So if you're able to use that for your agency, and then we're going to give you all the follow-up information for Aeroflow Urology, for Peter's information for his books and websites and everything, and then for Foster the Family as well. So again, thank you guys so much for being here, and I'm going to pass it off to Mica.
Okay, great. Thank you all so much for having us on today. All the respect in the world for what you all do as foster parents. It's an incredible responsibility that you all take on, and we're thankful to be a very small part of the support structure that helps you all do the amazing things that you all do. One of the things I consider myself expert in is the ability to navigate insurance, to get specific benefits from insurance. Insurance is an inherently complicated topic, and I'm proud that we as an organization can really help to navigate a complicated process to get something that hopefully relieves some of the burden from the many things on you all's plate. So I've got a couple of slides here that we're going to go through. If you want to go ahead and go to the next slide, there is just kind of an outline of the different topics that we're going to cover today. We're going to talk about introductions and how our program affects foster children, who we are as a company, and as I said, a great deal of content about navigating the insurance landscape to get benefits that are available to your children. And then our Q&A. Next slide, please. So first of all, I always we consider one of our core missions as a company to destigmatize incontinence as a condition. Everyone is aware that adults struggle with incontinence in some cases. Children struggle with a variety of different toilet training milestones depending on their specifics. What we really like to point out is that as common or normal as you may think these things are, they're far more common than people realize and happen in a far greater range of things. I'm sure all of you that have foster children have a variety of different histories and backgrounds that your children have had before coming to you, different underlying medical conditions and things like that. The commonality being that they may experience delayed potty training milestones, but there are so many reasons why they can be. And one of the things that we try to do as an organization is just say, non-judgmentally, we are here to recognize a need and try to get as much background information as we can and try to find the best solution for you and your family that takes this one worry off of your plate. As we said here, incontinence can be highly stigmatized no matter who you are. It can be a really sensitive topic. Children attending school, the idea that, oh, I shouldn't still be wearing an incontinence product past this age, my friends aren't. There are so many reasons why these sorts of things are a spectrum that can be highly variable. And we have a great deal of content on our website that really speaks to those sort of things in an effort to really say, we want to manage the condition and manage the need, but we definitely also want to make sure to understand that there are a whole range of outcomes that can happen as it relates to this topic here. And there needs to be no shame on the parent's part, child's part, anything like that. And that's something that we take incredibly seriously. A little bit of background about Aeroflow. We are what's called a durable medical equipment company. We've been in business for about 25 years. We're a family-owned company in Asheville, North Carolina. We employ about 1,100 people. about 800 of those working in direct patient care, so working directly with patients and their families to get insurance benefits through insurance and get them delivered to people's homes. We're headquartered in Asheville, North Carolina, but we have employees that work all across the United States. We have a few of our credentials here, Medicare and Medicaid accredited. One of the things that I'm proudest of, if you ever go to our Google page, we have over 17,000 reviews with a 4.9 star average, and there are some incredibly honest and personal stories in those reviews where people who have received service from us through their insurance are really speaking very openly and honestly about what it's meant for them and for their family in a way that, I'm constantly surprised at people's willingness to be publicly visible about the impact that getting supplies through insurance can have on them and their family. But it's also one of those things where anytime I'm having a bad day or having some challenges at work, I can go look at the reviews that our patients have talking about us as a company and the impact that we're having on people's lives by what we do. And it's always kind of a North Star for me and for our organization to help navigate a complex landscape for folks that are dealing with a variety of different things within their own families. Something I'm incredibly proud of. I have worked leading our incontinence division for 11 years now, since we had 2 patients and 2 employees. And now our division serving people with incontinence has over 200 employees and serves tens of thousands of patients in 40 states across the United States. And so we've been really incredibly fortunate to be able to get in front of so many people and provide service and develop a program that I'm incredibly proud of. So just a couple of things, and this is true for us, it's true for many medical equipment suppliers. Kind of what does it look like to have a medical supplier that gets you benefits through your insurance? The very first thing we lead with is handling insurance paperwork. Getting supplies through insurance can create some hoops to jump through. Insurance is going to make sure that you have to have a prescription from you or your child's doctor, may require some underlying medical justification. Just knowing what's required is actually half the battle. And one of the things that I'm proudest of is that when someone reaches out to a company like us, to Aeroflow, we know a lot of the rules that why Florida Medicaid may be different from North Carolina Medicaid, may be different from South Carolina Medicaid. Even sometimes the insurance plans in the same state can be different from each other. We are proud to be expert in those different insurances, to look at the person who's been provided to us, run their benefits and say, based on your specific insurance, here's what we're going to need. Here's what the process looks like. You're going to need to see your physician for a face-to-face, et cetera. Really try to spell that out in plain English as much as we can and try to help facilitate that in order to set you up to get your supplies through insurance. We're also really proud to engage with our patients in a variety of ways, such as having an application where people can go say, it's time to refill my supplies, communicating with us not just through phone calls, having to pick up the phone, but through text and email as well. I know a lot of folks work 9 to 5s, and so being able to call a place that has conventional customer service hours during the workday is no sure thing. And so we're very proud to have a variety of different ways to communicate with us. Obviously, wanted to point to our partnership with Foster the Family here. We are very proud to have recently kind of recognized what a large resource we can be to the foster community. Organizations like Foster the Family are such important partners for us because this is a segment of the population that we are really looking to increase our awareness and be more of a resource. Very, very proud to be introduced here today. As I had said before, we've been doing this for 10 years. And as we've been doing this, our understanding of who our patient base has evolved over time. We actually started this business thinking it was going to be mostly a business to help seniors dealing with incontinence. It took us actually about a year to realize there's actually a huge child and special needs population out there for us to assist: children with autism, children with Down syndrome. That was an understanding we developed over the first few years of our business. And just as with that, we've recognized the huge potential to assist the foster community here over the last few years. And so again, incredibly excited to partner with Foster the Family and organizations like them to help get the word out and to help more people. So this is one of the things I always like to kind of point out is the breadth of supplies that insurance can sometimes make available to people. People don't realize that disposable incontinence supplies are covered by their Medicaid plan, but it's more than just the diapers or the pull-ups that are covered in many cases. There are also underpads for changing or for crib lining, bed lining, chair lining, depending on mobility. There can be gloves to assist with sanitation of changes. There can be barrier creams to assist with dermatitis and skin rashes and things like that. There can be changing wipes to assist with cleanliness and things like that. Those items that are specifically covered vary widely from state to state and insurance plan to insurance plan. But again, that's one of the things that we as an organization are proud of, is that we've gone ahead and built a database of what those covered items are. And so when someone comes to us and says, this is my specific insurance, we can tell you specifically what your insurance covers and help you set you on the path to get those items that meet the needs of you and your family, and to navigate any of the documentation that's needed from a physician. Again, just knowing what is covered is half the battle a lot of the time. You'll hear me say that a lot. It's because it's the truth. So who qualifies to get no-cost supplies through insurance? Thankfully, in most states, it is set up for children in the foster care system to be issued some form of Medicaid. Commercial insurances, so that which might be issued by your workplace, for instance, or marketplace plans, do not typically have coverage for incontinence supplies, but Medicaid, even as a secondary insurance, in most cases will. And so for example, if your child is on your workplace insurance as primary, but still qualifies for a secondary Medicaid, in many cases, they can still be covered for incontinence supplies. And that's something we always like to point out because people don't realize that. Having Medicaid, there are some age requirements depending on the state. There'll be a minimum approved age, which is typically 3, but is 4 or even 5 in some states, where if the child is under the age of 3, 4, 5, there will need to be a really detailed medical justification to receive coverage. If they are over the appropriate age floor in that state, then typically it would just require a prescription and possibly medical history just to certify that need for insurance. Again, those are all parts that we will educate on as part of our service and help work with the child's pediatrician and primary care physician to try to get everything that we need to move forward. The other thing that we're really proud of, and I think everybody's seen a lot of things in the news over the last couple of years, Medicaid changes over time. The health insurance landscape changes over time, not just for you personally, but kind of at large on a state and national level. We pride ourselves on putting out a great deal of educational content about subjects like Medicaid work requirements, Medicaid re-enrollments, Medicaid income level changes, disability changes, things that help educate on the fact that insurance is inherently complicated, and sometimes just to maintain Medicaid coverage for you or for your child, there can be some administration that is required and things that change over time. And so we also put a lot of energy into putting content out that helps educate on that and helps keep people informed about something that, if you don't pay attention, sometimes things can change and you may not realize how it can affect you or affect your family. What is Medicaid? I think everybody has a passing familiarity with it, but we always like to make sure that we clarify this. Medicaid is a federally subsidized program that's administered at a state level. Every state has their own Medicaid program. They're all different in so very many ways because of state administration, state budgeting, population, and all those different factors. So again, a patient who lives in South Carolina and a patient that lives in Florida, in some cases, can have very different coverage levels available to them. We deal with patients sometimes who move from one state to another and can see that work for them and work against them. And so again, we try to educate people on what is your current situation and what does that entitle you to because of the particulars of you and your family. Managed care is another thing that I think people sometimes have a passing familiarity of, but if any of you folks have Medicaid, but your card says it's Blue Cross Blue Shield Medicaid, it's United Healthcare Medicaid, this is what's called managed care. This is when the state contracts private insurance companies to manage some or all of their members under that insurance company. What that can mean in practice is that benefits can actually sometimes be more than the normal state level, and sometimes they can be, in some respects, less than the state level because of the complexity of how individual health plans administer their coverage. And so we run into situations where maybe at mid-year in June, when open enrollment happens in your state, you had United Healthcare Medicaid, now you have Blue Cross Medicaid, and that may actually change some things with what's required from your child's doctor, what specific products and quantities they're entitled to. So again, I sound like a broken record, but just being made aware of the particulars that you're entitled to of you or your child's insurance in that moment is often one of the most powerful things, and one of the things that we try to spend a lot of energy on, making sure that we are educating our patients and their families on as much as we can, because things change sometimes without your knowledge. A lot of times your child's Medicaid plan they'll give you a chance to select a different plan, but if you don't fill out that paperwork and send it into the state, they will just elect to put your child in whatever Medicaid plan they choose to by however they're doing the live distribution. So sometimes people won't take action, and by their not taking action, something will actually change in a meaningful way in the benefits that they have access to, and folks don't realize it until sometimes it's too late. And so again, we really try to put a lot of energy into educating on that sort of subject. Also wanted to point out here, EPSDT is something that you all may be familiar with, depending on the specific needs of your children. EPSDT is a special program that exists in most states for coverage of items and benefits and services that are not normally covered under the medical benefit. This is a service where if you've ever been denied service through normal Medicaid benefits, there can sometimes be additional screenings and processes to go through that can provide you access to benefits you've been denied for. And so we always like to make people generally aware of that service, not just as it relates to our products, but as it relates to behavioral health things, other medical goods and services, that there are sometimes waiver programs and other procedures to tap into that people are not aware of if you've been denied a vital service for your child before. We always like to advocate for the existence of those programs because, again, knowing that they exist is half the battle in some cases. As I said earlier, why stay up to date with your Medicaid? Every state is different when they do open enrollment. Some states change health plans in January, some do it in the middle of the summer, some do it in the fall. It is literally different across all 50 states. And so just knowing the particulars of your state, when that letter is going to be coming from the Medicaid office that says, hey, we're going to be changing you have an opportunity to change your child's medical coverage. Would you like to elect a different health plan? Knowing when that's coming is important. Knowing when it's coming as it relates to your current on-file address is incredibly important. We very often see people's insurance coverage get disrupted because they moved, because their recertification packet for their child was sent to an old address because they moved to a new home or to a new apartment or what have you. That can have a huge impact. And so again, knowing when these vital pieces of information are required by Medicaid so that you can keep your contact information and address on file with Medicaid can be a really impactful part of making sure that you retain your insurance coverage and benefits. And so we try to do as much education on that as we can, but we also tell people, educate yourself from your case manager, from whatever contacts you have with your insurance company on this. These sorts of things can impact you more than you would realize. Who is eligible for Medicaid at a high level? There can be very many reasons that someone is granted access to the Medicaid program. As I said before, thankfully, many states have an automatic provision for children in foster care to receive Medicaid. I think that's an incredible benefit to offer because the having of Medicaid and things being covered typically at 100%, the annual visits and wellness visits that opens you to take a lot off the plate of obviously parents who are already dealing with the transitional effort of integrating a child into their home. It is also for folks at or below the federal poverty line, retirement age, people in institutional settings like assisted living facilities and group homes, or who have a variety of special needs or disabilities. And obviously, in many cases, several of these things can be true of a person or of a family. And so again, the Medicaid program is there to address a variety of different needs, regardless of what that underlying need may be. As I said before, managed care and private insurance. A lot of these are names that people are familiar with: Aetna, Humana, United Healthcare, Blue Cross Blue Shield. These are plans that can exist for Medicare, covering retirement age people, working age employer type plans or marketplace plans, as well as these entities all manage Medicaid plans depending on what state you're in. They all have a Medicaid brand: United Healthcare Community Plan, Aetna Better Health, Blue Cross Blue Shield Healthy Blue, Humana Healthy Horizons. These are the Medicaid entities of these states that, depending on the states that you all live in, they may operate in your state. And again, they can, in some cases, behave differently than the regular Medicaid plan in that state. So, tips to receive your supplies through insurance quickly. As I've said several times already, every insurance plan is different. One of the biggest things that we like to educate children and families on is the involvement of your child's pediatrician to the process of getting supplies through insurance. Many insurance plans have set up requirements to have your child's medical history or the underlying reason why they're experiencing delayed potty training milestones on file with us, the provider, to be able to provide the service through insurance. And so obviously, as you're dealing with integrating foster children into your home, or just over the years that you have a child in your home, their pediatrician can change. You can blink and it's been a year since you've seen their pediatrician, and so their medical history may have changed. Very, very important to be talking to your doctor anytime, talking to their doctor anytime you speak to them about the progress with their potty training, what they're observing that may be leading to their developmental milestones. The more that can be documented, the better, because the insurance companies can, in some cases, be very specific in what they want to see. The more detailed and proactive that conversation is, and the more that you're actually calling on the doctor to enter that into the medical record, the more likely that what exists in your child's file is going to be something that's going to satisfy what we need in order to make that service available to you and to keep that service available to you year after year, because obviously incontinence is a condition that for some children, depending on, what their specific situation is, it may never fully resolve. And so this can be a need that evolves over a very long time period, and things can change over time. The more proactive you can be about involvement with the physician and the more detailed about documenting what the latest of their health is, the better it sets you up for success of navigating the insurance program. These are things we see in social media comments. We hear from patients all the time, and we like to dispel some of these things. If I didn't qualify before, I never will. We hear that all the time about eligibility for Medicaid. We also hear it all the time from patients who have attempted to get incontinence supplies through Medicaid and who have been told no from a different provider. Insurance rules change. Your insurance plan changes in some cases. That you've been denied once is actually unsurprising in some cases. If you have the right sort of provider advocating for you, you will have a resource in your corner, as well as your child's physician, to overcome denials, which can happen in some cases. We often hear the paperwork is too complicated. We hear that from both parents as well as from doctors, and we agree. The insurance landscape is complex. It's a lot to navigate, especially with how it differs from plan to plan. A good provider who knows the ins and outs of the different rules will greatly decrease that complexity just by clearly communicating to you and to your child's physician exactly what's needed. Only basic products are covered by my plan. My plan only wants me to use cheaper products. In reality, by using Medicaid benefits, there can be situations where often you're not going to receive Huggies or something like that you can go buy in the store. You're often going to receive what we call medical grade products that may be brands you're unfamiliar with. In many cases, these are actually are higher quality than the products you buy in the stores. They're just going to be different brands. Sometimes you are somewhat limited in what those brands are by your specific insurance. Again, we pride ourselves on having over 175 people that work on the phone servicing our patients and families. And we have an entire part of that 175 person team who does nothing but navigate challenges with products. This product's not absorbent enough. It's not fitting my child around the leg gathers. It's not fitting them around the waist. It needs to be taller. Their torso is long. These are all real challenges that happen. And it can be a very personal and sometimes trial and error process to get into the product that best manages your child's condition. The right provider will work through that and try to do everything they can to reconcile the requirements of your insurance with your specific needs and find something that works. And as I said before, I've been denied coverage. How do I appeal? Denials by insurance companies are an unfortunate fact of the complexity of our medical system. In many cases, fighting against denials will yield positive results. And so persistence pays off, and having the right partnership pays off. Again, I cannot stress enough the importance of having a highly engaged physician who is not just coming in and doing a 5-minute sit down, see your child, on your way back to the next patient. Look for a physician that is really invested into the unique needs of your child and willing to talk about it in detail, so that when you want to receive a product through insurance, you have support from a doctor who will help write letters of appeal, letters of medical necessity. As a person who's helped indirectly navigate thousands of denials from insurance, the physician's buy-in and detailed communication is the most powerful tool to overcoming an answer from insurance. And then I think my insurance will only cover a small amount of supplies. Varies widely. I don't mind telling you, some states will entitle a child to 80 diapers per month, and some states will entitle a child to 300 diapers per month. That is an insanely wide banding, and it is subject only to the differences of how that particular Medicaid program in that state has chosen to outlay their benefit. There are provisions for the child who's only entitled to 80 to possibly receive more than that 80, but that's the sort of thing where you'll probably have to have a detailed reasoning from the doctor to be able to overcome the normal requirements. But that just goes to show you the wide degree of complexity that comes just from the simple how many of something can I get in a month that results from insurance. And again, just knowing what those are is half the battle. So a lot of technical information there about the Medicaid program and things like that. The thing I always like to stress to everybody is I often see parents try to navigate the insurance system for their child, encounter a roadblock, and unfortunately kind of lose momentum on getting through that roadblock. I cannot tell you how many initial denials or initially, hey, the paperwork that your doctor gave is just not quite what we need. But if you can just give them a call, we're going to give them a detailed fax and say exactly what we need. If they can just amend this slightly, I think we'll be able to be there to get you their benefit. That may seem like, oh, I can't do this. This is too hard. I cannot stress persistence and involvement enough as to how much of a difference it makes. I've seen it time and time again. And so that if you hear one thing in what I say, it is if you're trying to get your child not just this benefit, but any benefit through insurance, do not just take no for an answer. Know that there are systems set up and there are partners that exist that can help you navigate those systems, and remain persistent to get what you need to set your family up for success. That'll be it for my presentation portion. I wanted to open the floor, one, for any questions that everybody may have, and two, if Peter or if anybody else would like to interject on anything, I would love anybody to.
Anybody have any questions? There's none in the chat box, but don't be shy. You can just take off mute since there doesn't seem to be a ton and just have a conversation. I will also share one thing that I was sharing earlier is, as I know there's a lot of foster parents on here, there's a lot of child welfare workers on here. And one other kind of perspective when getting our kids these products that they need while they're in our homes is obviously our goal is for reunification either with their biological parents or with relative placements. And so by us taking this step and helping them get these products while they're in our home, that's going to relieve such a huge financial burden when the kids transition back into their biological family's home or wherever their forever home is going to be. And then this service will already be in place. And so all we'll have to do is change the address, the shipping address. And so as we're trying to help families and help them stay together by being able to remove this financial burden, that we're easily able to walk through the process. And now we're all knowledgeable on how to do it. It's just a great service that we have the opportunity to use in our own homes, but then also be able to transfer with the kids whenever they move into other homes as well.
And for me, the other part that I really love, how Aeroflow kind of comes in for me, when it comes to foster care, we get to advocate for children and then the foster parents or the bio parents or the adoptive parents. But most time, I think it goes towards the child or the support is towards the child, but they never remember us as the caregivers, And I love that Aeroflow comes in between because they are helping me understand. So for example, I'll give you an example. I take my kid to daycare, but they're like, this kid cannot be in the next class because the potty training is just not improving. It's hard for me to say, well, there's an underlying issue, that is happening to the child. If I say they just think, Peter, come on, you're not trained well to train your child. But having the Aeroflow comes in, it really helps me to also navigate that. I can come with documentation to the daycare and say, hey, by the way, this is recommended for my child because of my child's issues that need to be, they don't need to be held back, or don't hold that against me. Like, I have support, but also I have tools that we are working on that my child has no problem, but it's just the trauma part of where they grow, rather than look at me as a parent and say, what's wrong with you, Peter, as a parent, but we're trying to say, no, my child has an issue, and would you work with me to make sure that this is really taken care of in the best way possible? The other part too, I go shopping to any shopping place, and as a parent, I think sometimes I feel embarrassed that I have pull-ups for my kids who are 10 or 7, and in my head to think like, oh gosh, I wonder what people think of me, But for me, that I get to have all the resources shipped to me, that they're dropped at my door, and I don't have to explain to anyone. I don't have to feel the shame. It really, really, for me, helps me the sense of confidence, in my own life. Like, hey, I know they're gonna arrive. I don't have to worry. The shame, yes, is still there sometimes, but it really helps me navigate that in places that I go or I get to be at. Or sometimes, I run out, and I know I cannot send my child to the next event. Camp is happening now. If I didn't have enough, it'd be really impossible for me to send my child, knowing, because I don't want the shame towards my child, but the shame towards me either, But having all that I need at all times without always having to worry, am I running out? Oh, I need to go get some. I only have 5. But knowing that every month at a particular time, I get enough that will cover my child through the next 30 days is a relief for me as a parent, to know that I'm covered and I don't have to worry about that. Then now I can worry about what camp they're going to and how I'm going to drop them there. But the rest is taken care of. And for me, that really helps. The other part too, for me as a single parent, who came in, I had never been a parent before. Sometimes navigating the doctor's office, where I kind of really, I was afraid to ask, or I wasn't sure what to ask for, or the complaint I got from school, I didn't know how to transfer them to the doctors, And that for me, Aeroflow really helped me on how I advocate for my child at the doctor's office, The knowing if I can share with the doctor the needs, the way they write the language on those notes are super helpful because they want to support me, but they cannot support me if I don't really explain my needs are. And sometimes I think we are not ashamed, but we just think, okay, it's part of training. Why do I have to tell the doctor about this, But that is important, because that really helps the child to grow, but also gives us the tools and the way to navigate the insurance, So for me, having Aeroflow in my life is really helped me how I navigate, or how I help my child at the doctor's office. What used to be simple, now I make it a big deal because I want them on the notes for the doctor's notes. So wherever they go, wherever sees them, if it's Aeroflow, if it's the insurance provider, the notes that the needs of my children are included in the visitation at the doctor's office. And for me, that has really helped me so much that I don't have to go back and forth. Hey, I need this. Can you sign this? But by them knowing every visitation at the doctor's office of my children's needs, they help me navigate on how I get all the tools for me as a foster parent as well. So, yep, that's kind of what I had to share. But you can ask anything. We're here to really help you navigate or sign up or see how that will be of help for you.
Can I just ask that, should we talk to the pediatrician first before we deal with Medicaid? Is that the best route to go?
Yeah. In most cases, unless there's some sort of a denial or exception needed, which is only, I would say, needed a minority of times. So there's normal coverage framework set up. In some states, it is as simple as we talk to you, we get your child's needs in terms of what size product they're in, how many times per day that product's being changed. We send a prescription to the physician signs that, and it's actually just that simple to get a prescription. In other states, there's, as I mentioned, kind of the underlying medical condition, medical justification for why the delayed potty training is needed. In those cases, if you would replay the conversations with your physician and say, well, we haven't necessarily gone into detail about why the potty training is where it is. In those cases, what we recommend is reach out to a company like Aeroflow, give us your child's insurance information. We're still going to get what those needs are. We're still going to send that prescription and a request for that medical history over to your doctor. But if the conversation has not been had with the pediatrician for that to exist in the medical record, it may at that point necessitate you setting up a new visit to have that conversation, have it entered into the medical record to set things up to where that documentation exists. Think of the documentation as a plan of care, so to speak. It's kind of a survey of here is where my child is today, here is what they're dealing with, here is why that's occurring. And then we're going to look at everything your doctor can provide as a function of that visit or that already exists. And we're going to tell you, hey, Dr. Johnson signed the prescription. We're great on that part. There's nothing in the medical history about an underlying diagnosis. You may need to talk to them directly, see if they're willing to send us an amendment to the office note, which is where they go in and say, this child is struggling with incontinence due to autism and delayed potty training milestones, post-traumatic stress disorder, whatever it may be. The requirements can be really specific sometimes. We will provide as much education not only to the parent, but also to the doctor on like our fax cover sheet as we can about the specific guidelines to really try to aid in that. So in most cases, contact with Medicaid won't be required. We do recommend anytime you fill out an interest form with a company like Aeroflow that you also take the time to go ahead and contact the doctor and make them preemptively aware that you've done that. Because in many cases, we do run into issues where Medicaid wants to see a diagnosis of incontinence to support these products. Many pediatricians don't inherently think of potty training milestones as incontinence. We'll even have some pediatricians push back and say, they're not incontinent, they're 4. And we say, I completely understand where you're coming from a clinical perspective. From a DME medical benefit coverage perspective, this is how things need to be documented in terms to satisfy their insurance requirements. So just you reaching out, one, lets them know that we're a legitimate company and we are reaching out on your behalf. And 2, if they have any sorts of concerns or want to voice the need for a visit specifically to discuss those things, they can go ahead and have that conversation with you directly and maybe even get that appointment set up. Because very often, if parents don't make their doctor aware of reaching out to us, when we send the request over, we'll get communication from the doctor of, I don't know anything about this. I'm going to need to see the patient. And that can delay the process by days or weeks, depending on the time frame of that feedback. Whereas if somebody preemptively makes the doctor aware, it can really compress the timeline. We've seen situations where you fill out our form and we get a prescription 3 days later and your child has supplies the same week as you filled out the form. I've also seen situations where needing to satisfy the incredibly specific documentation guidelines, it unfortunately is a process that stretches back and forth between us parents and the doctor for months sometimes. That is not the norm, and the more proactive and involved you are with your doctor, the less likely it is that it's going to be a process that drags on.
Yeah, it's not all like my child. It's well documented that he has autism, and I think they use the words developmental delays, but it's so broad. It's just an umbrella word that doesn't break it down to the incontinence level. But there's a lot of things under that umbrella word. So I see where the insurance company is going to want to be so specific. But again, that's the umbrella word. You know, there's all these other things falling underneath that. But I guess with my situation, my best bet is to reach out to you first. It sounds like, because my child is registered with Johns Hopkins Hospital. He has a specialist who he sees once a year for his autism. His school is well aware with speech and other needs that he has. It's just, I think my end, for me personally, mine might be a little easier. Is the best way to contact you through aeroflowurology.com, or is there a number I should call first?
Either that you're comfortable with. I believe the link to our what we call our qualify through insurance page will be shared out in the follow-up email after this. That is probably the very quickest way, just because assuming you enter your child's insurance information correctly and it's a plan that we're in network with and all those sorts of things, you'll actually be put into an experience where we will show you the items that are covered by Medicaid and allow you to pick the size the height and weight for your child, and so the size they're in, all those sorts of things. There's a search tool to input the doctor that the request is going to go to. You don't necessarily need to speak to anybody on the phone to give us the information that we need if you have all the insurance qualifications that you need to get into the experience. If you prefer to do that via phone, we have folks that staff the phones from 9 to 7 p.m. Eastern time, Monday through Friday, who are happy to perform an intake that way as well. Either way is fine. And then it's totally fine to do it the process of just have us send an initial inquiry to the doctor provide whatever already exists on file back to us. And then us, if for any reason what we need is not in what they initially send us, we would let you and the doctor know the very specific thing that this insurance requires is not in the medical record. You and the patient and the parent may need to confer and make sure to hear the guidelines that would need to be satisfied.
I'm glad to know this information because I have spent a lot of money on supplies since I received my child, since he's almost 6 years old, and I got him when he was 1. So it's been a tremendous amount of money. Not that I even care at this point about the money, but had I known about these services earlier, I mean, really would have helped a lot. I mean, Foster the Family has been very helpful to me. And I actually have 3 foster boys, but one of them is incontinent, so with other issues. But they have helped me tremendously with other things. But this is such a wonderful thing. It's going to be well appreciated by many people.
I'm really glad to hear that.
Yeah. And I'll give an example. So, my 4-year-old, we reached that, I thought we had reached the milestone for training, but then I noticed the pattern. So she was going to the party, but it was on specific days and a specific time. So then I realized that was more trauma related, because she was responding to something. So once I went to the doctor, I got to explain that, and all she did was just put a little small note for me. And that truly helped me in so many different ways, because she's going to school and they needed that note as well, rather than look at me like, hey, Peter, you need to train your child, but rather they come alongside like me sending extra in her bag that they know, hey, we know, these particular days or this week, things are rough for her. So we're expecting what's going to happen. And for me, that is all I needed. It wasn't so much about the diaper. It was just so much the people on the other side to understand my child that she wasn't doing it because I didn't do the right thing, but what was going on in her mind and her trauma that was contributing to her issues. And that for me was a big relief. And that's why I love really working with Aeroflow, that they helped me learn how to navigate that in the best way possible.
I really like Peter's point about how getting the documentation from your doctor is useful in other avenues, whether it's a school nurse, whether it's a day program, whatever that may be, to kind of think of it as a plan of care. Integrated involvement with the physician and detailed justification / up-to-date milestones is such a powerful thing. And it's powerful for behavioral health, speech therapy, medications. There's any number of things that these things can support. The biggest problem we see sometimes is the nature of a pediatrician or primary care visit. It can be a really quick visit sometimes. It's come in, are there any major problems? There's no major problems. Okay, and I'm out of the room. And it's a function of how modern medicine works in some respects. Slowing down and having that detailed conversation and making sure that you're specific with the doctor about, can you make sure you put something in his record about that? It's a very powerful thing that really can make a huge difference. And then it gives you something that can be useful in a variety of other avenues to have that sitting there to say, here is the representation of a picture of my child's health as confirmed by their physician.
We do have a question from Lauren, and I just wanted to mention, because I'm in Florida, so I have direct experience with Florida and Johns Hopkins. For the kids on Medicaid or CMS here in Florida, they are actually very generous with the amount of diapers, pull-ups, and things and we have never had issues with qualifying for 12 kids that we have done in the past that have been in our home and transitioned out. So especially if you're in Florida, don't be scared. Florida really covers you with Medicaid. And again, as he was talking about, the managed care with the CMS program is the one that I have experience with. But all right, so Lauren's question is bedwetting only something that may be covered? What is the renewal process like? Is it difficult to prove that a child still needs the supplies? And what types of medical professionals can write the referral? Pediatrician, just retired and don't have a new one yet, but have a social worker and a psychiatrist. Could any of those work for the referrals?
All right, all great questions. I'll tackle them one at a time. So is bedwetting only something that may be covered? I will tell you the majority of Medicaid plans bedwetting as a standalone diagnosis, nocturnal enuresis, would be sufficient to satisfy medical necessity. There are some, United Healthcare would be a really common one, where that diagnosis alone would not be adequate. They would want to see, in addition to that, developmental delay, failure to thrive, oppositional defiant disorder, sensory issue, whatever it may be. They would want to see something that is the contributory factor toward the bedwetting occurring in addition to the bedwetting. For many other insurance companies, bedwetting as a diagnosis alone would be adequate. And so most of my very specific answers are always going to come with that qualification of it does depend on the insurance, sometimes in very specific ways, but bedwetting would generally be a permissible primary diagnosis to be able to receive incontinence products through Medicaid. If you fill out our interest form with specific insurance information, we would provide you the detailed reasoning of exactly what's covered. We would send the clinical request to the doctor to get the progress notes. We would review the progress notes, and if something were missing that would meet requirements, we would specifically tell you what that is. The renewal process. So that can vary pretty widely from insurance state to state. Some require a renewed prescription from the doctor every 6 months. Much more common to need a renewed prescription every 12 months. Sometimes that's a very simple process. We just send a new prescription over every 6 or 12 months. The doctor reviews the prescription, they sign it, they return it to us. You would never even notice any disruption or anything like that. There are a lot of states that require renewed face-to-face clinical notes as part of that recertification, which obviously, if you haven't seen your child's pediatrician in the last 6 to 12 months as part of a normal visit, or if you had seen their pediatrician but you had not discussed the incontinence issues, could present a challenge, because we may receive the prescription we need, we may not be able to receive the clinical face-to-face notes that we received because either there wasn't a visit or there wasn't a visit where you actually talked about these milestones, which goes back to the point I continually make sometimes ad nauseum about being really specific and making sure that you force the issue to come up as part of those visits as best you can, to make sure that the evidence exists in the medical record every 6 to 12 months for us to keep the child. Is it difficult to prove that they still need the supplies? As long as those things are satisfied, in most cases it's not. There are a few states, Michigan being one of them, that cap the benefit, where they say if the child needs to receive incontinence supplies for more than 3 continuous years, they need a really extensive medical review about why that is. That's not common. Most states have kind of a continuous benefit as long as the prescription and face-to-face note requirements are met. And so I always say, if you're keeping those annual visits with your child's doctor and you're having those conversations and making sure they're in the medical record, and if you're keeping your provider up to date with who their current pediatrician is, that's another stumbling block I see sometimes, is we're faxing Dr. Green for 2 months and we're going, why is Dr. Green not sending back Johnny's supplies? And then we realize, we finally get them to tell us, patient hasn't been seen here in 2 years. You've been seeing a new pediatrician. That was not told to us. We're faxing the wrong doctor. And so a delay or a disruption can happen because of that. So also important to keep the current pediatrician on file, up to date with us, the supplier, as well. As far as what types of medical professionals can write the referral, it needs to be a physician assistant, nurse practitioner, or some sort of a physician. Unfortunately, a psychiatrist would not be an approved provider in most cases, because it needs to be a medical doctor in the general medicine sense, and a social worker would never be permissible, but a physician assistant, nurse practitioner, or a physician would be acceptable. And so often we tell people, if you're having a hard time getting in with a primary care or pediatrician, but if there's a nurse practitioner or a physician assistant that's easier to see at that same practice, and often there is, I know there is at my primary care, those individuals can write for the supplies in the vast majority of cases just the same as a physician can. All really good questions.
All right. Anyone else have any questions for Mica, for Peter, for myself?
Maybe I do. How, once approved for the supplies, how it comes, what, once a month?
Yes, monthly. Insurance allows for a monthly shipment of supplies. Obviously, when we deal with things like bedwetting, sometimes a shipment of supplies, you may find that because the bedwetting frequency changes more or less, that sometimes you have to change the quantity you're receiving. We'll have parents who initially come to us and say, I think he only needs 90 a month. And sometimes it goes one direction and you go, gosh, he's only doing it once every 3 nights. This 90 is going to last me for 3 months. Or conversely, hey, this is getting more frequent. My need's no longer covered. So you can see some variability of the quantity, but the shipments are covered monthly. And then, as I say, recertification is required every 6 to 12 months, depending on the insurance plan. The other thing I like to point out is, and this seems silly to people, but right, children and people, their bodies change over time. The size of the product changes over time. Sometimes that can necessitate the need for a new prescription. Believe it or not, insurance codes a size small diaper as a different procedure code than a size large diaper. When your child hopefully gains weight on normal developmental milestone curves, or if they lose weight for any sort of reason, a need for a new size will sometimes necessitate the need for a new prescription. It won't typically necessitate the need for new chart notes because the therapy is the same. It's just the billing code is different. But parents will get frustrated sometimes. They'll go, what do you mean you need new paperwork just because he needs a size? And we always say, we share your frustration. It's not a process we love either, but that is how insurance has set it up. And so there may sometimes be a need for more frequent prescriptions than every 6 to 12, but that would be as a function typically of a size change. Or if, for example, they move from a diaper with tabs to a pull-up product, those are also coded differently. Insurance loves to make it easy. But we'll try to make clear what those things are and advise you of that anytime a new prescription is required. Because again, the most powerful thing in those situations, the doctor will typically return our prescription. They'll return it a lot quicker if you call them than if we bother them. The supplier, they care about us, but not as much as they care about the parent or the child. And so any amount that, if you know we've asked something for your doctor, just that simple, you pick the phone up or go into your patient portal and send a notification of like Aeroflow says they're sending over a new request. You would not believe how much that helps with turnaround time and speed to get us back what we need.
Yeah, the reason I asked is because my son would require to have the pull-ups at school and at home. So I don't really know how many I need. I don't know how many I would qualify for. So I need to make sure that I have enough quantity. And if I don't, then I have to buy in the meanwhile.
And what we'll educate on is typically we will advise you of the max benefit. And so, for example, Florida is 200 per month. Illinois is 150 per month. South Carolina is 80 per month. It can vary widely. We'll tell you what the maximum is. You can think about that as 200 is 6 to 7 changes per day. 150 is 5 changes per day. If you think about it in terms of how often you're likely to need that product change per day, we always advise we're going to let you know what insurance covers. Err on the side of probably something that sounds like as much or slightly more than you need. And then there's always an opportunity for you to say, hey, he's actually advancing. We're changing these a lot less often, and we can update that plan of care to be 60 or 90 in subsequent months, and we can adjust that over time.
We would contact you for that.
That's correct. And it's counter. No prescription is needed to decrease the quantity, right? Because we have a prescription for more. But should you say, I asked for 90 initially, turns out I'm actually going to need 150, that too would necessitate a new prescription from us. Another reason why we advise err on the side of making sure you have enough, and then always be willing to adjust that plan of care down depending on what the real world needs and development is, which obviously we know can change greatly child to child.
Thank you.
Yeah, absolutely.
All right. Any other questions? One thing that I want to encourage as well is I am going to send an email at the end with all of the different links that were in the slides, the Aeroflow link to find out about Medicaid and how to get plugged in with them. Again, for Peter and foster the family as well, and the video. And I encourage you, please share the video link with friends, family, just like you were saying, Eva, like you didn't know about, we want everybody to know that this is out there. It's not like a little kept secret. They'll never run out of continence supplies. So let's share it with, all the families that we serve, with all the families that we come in contact with, whether they're really foster, adoptive, biological, if they're on any of these insurance plans and they have kiddos that could benefit from these products, as well as the parents and the families, I encourage you guys to feel free to share it. We are open-handed with it. You'll also have all of my contact information, so please feel free at any time to reach out to me. My email's on there. I'm always available to answer questions, whether it's about this or anything else. So we are getting close. I'm going to do one more last time. Any questions that maybe we didn't cover? No. Oh,
Be remiss if I gave one more point. if you fill out our interest form online, you all know insurance is complex. I've said 75 times. There are certain Medicaid plans which Aeroflow is not contractually able to work with. There are certain insurance plans that have said, for example, for an incontinence benefit, you can only use this one certain supplier. If you fill out our interest form and you receive an answer that we are unable to assist you because of your specific insurance, feel free to reply to that email, and we would be able to give you some alternative suggestions based on your insurance of other suppliers that may be able to help you. We're unfortunately not able to help 100% of insurance plans. We are fortunate to be able to help about 75% across the United States. We'll try to, if we personally can't help you because of contractual reasons, we will at least try to give you some alternative companies that would be able to provide you service that'll take good care of you.
Well, thank you, Mica. Thank you, Peter, for sharing all of this knowledge. I know if everyone was like me, taking notes, but don't worry, because I am going to send it all in an email if you missed anything as well. And then I just want to take a minute to thank everybody who's on here who are caring for kids in their homes and are actively saying yes to kids and have said yes forever to kids. And just thank you for what you're doing. If you work with these families every day, thank you for taking the time to be here so that you can be an additional resource to them. We just love you guys, and I look forward to hearing all the good news about everybody being able to plug in and save some money. So thank you guys so much. It was wonderful.
Thank you.
Thank you, everybody.
Thank you.